microscopy is going to tell you. And now the next one is, that is in order for you to find a point of focus. Now the next one is the gastrointestinal system. You do a stool analysis, and then you do procalcitonin, calcitonin, is going to tell you that there are actually different things, the inflammation at the level of the GI tract, so those are the different elements that you visualize. Now after visualizing it, all this is going to result to a sepsis, and to visualize sepsis you ask for CRP, which is an acute inflammatory marker, and you visualize for full blood count, which can show you leukocytosis, provided the immunocompetence, so those are the different things that you are involved. But usually in diabetes there is not usually immunocompetence, so the full blood count may not be elevated, Now if you have done all this and then you have no results, and you have also done the full blood count, you have no leukocytosis, you now think of malaria, which can be also it can be an element of exclusion. Should always exclude malaria. You do, in order to test for malaria, you ask first for the rapid diagnostic test that is going to test for the antigen. When you have at least 100 antigen of Plasmodium falciparum, that is going to possibly for rapid diagnostic test. The second one after rapid diagnostic test is going to be the thin film. The thin film is a microscopy of the blood, where you're going to identify the species of the Plasmodium. And then the last one is thick film. The thick film, now you ask, now that one is going to tell you the number of trophos that exist per microliter of blood. So those are the different elements that you have to speak about when you visualize the precipitating causes of the diabetes. Now the next one is the complication of diabetes. Is it clear? Now the major acute complication that you have in hyperglycemic crisis is that the patient is dehydrated. Is it clear? The patient is dehydrated. And now what are the investigations that you can visualize for dehydration? So to support dehydration, you can use the specific gravity in urine dipstick. Is it clear? So when the specific gravity is greater than 1.020, it's a concentrated urine. So in this case you can have dehydration. The next thing, after the specific gravity, you have the hematocrit. If the hematocrit is greater than 55% or 0.55, is it clear? It is more going toward the diabetes, going toward dehydration, provided the patient is not anemic. And then to confirm now that the patient is dehydrated, you do the urea to creatinine ratio. Is it clear? And all of them should have to be milligram per deciliter. Divide urea all over creatinine, and then you are going to have, if it is greater than 20, it means that the patient is dehydrated. Is it clear? So those are the investigations that we visualize in order to say that somebody has the investigation that you visualize for diabetes. Now the next investigation that you need to visualize also is the background. Is it clear? So for the background, you need to find now the investigation for type 1 diabetes, and you need to find the investigation for type 2 diabetes. Is it clear? Generally, the investigation for both of them is that you ask for a fasting blood sugar in order to confirm if the patient is actually diabetic. So after removing all the stress, is it clear, you ask for a fasting blood sugar 24 hours apart. Is it clear? And if it is more than 126 milligram per deciliter at two different instances, that means that the patient is diabetic. Or you can do a oral glucose challenge test. Is it clear? In oral glucose challenge test, now you give 50 grams of glucose to the patient, and after 2 hours you measure the blood glucose. If it is greater than 140 milligram per deciliter, it means that the patient is diabetic. Or you measure the glycated hemoglobin. Is it clear? But glycated hemoglobin is more of a uncontrolled diabetes for more than 3 months. If the glycated hemoglobin is greater than 7%, it means that the patient is diabetic. Is it clear? So those are the different elements. Now all this is going to tell you that the patient is diabetic. Now to know if the patient has only type 1 diabetes, Is it clear? To know if the patient has only type 1 diabetes, you ask now for the anti-insulin antibodies. Is it clear? Anti-insulin antibodies, and in type 1 diabetes there is presence of anti-insulin antibodies which are going to target the pancreatic cells for the destruction of beta cells of the pancreas that produce insulin. So all this is involved in the investigation of diabetes. Now after that, now we are going to visualize now the treatment of diabetes.